Doctor, two quick questions. One, how far are we from a robust surveillance level antibody testing system in the state?
It's a great question. We are continuing to evolve in terms of our understanding of how testing can support the work that we're doing. Your question gives me an opportunity to do what I've been meaning to do for some time, which is thank our Rhode Island Testing and Validation Task Force, who has been with us throughout the pandemic and ready to address and assess questions such as what you're asking regarding antibody testing or any of the new tests that are available. So for now, we have time before we get to a robust antibody testing surveillance system. We're really focusing in on getting everyone vaccinated so that we're able to then move to that next phase of seeing how to sustain that and get the knowledge, science, and learning from our federal partners to help inform that.
Yeah, and further to that, people suggest that having antibodies can be more protective than being vaccinated. That's something we've talked about in the past, but do you have any updated science on that for these people who are insistent that they're more protected by having had the disease recently?
Yeah, we have a number of studies that have shown reinfection after a natural infection with COVID-19 occurs more than reinfection among someone who has been vaccinated. So while those thoughts were considered prior to Delta, what we really learned from the Delta strain is that vaccination is your most concrete way to confirm immunity. Natural immunity alone has not shown to be consistent in effectively protecting someone, particularly against the Delta strain of coronavirus.
All right, next over here, Steve. I presume it's the health department that's running this pilot program? No. Health education? How long is this pilot program going to run? How are you going to know whether or not it's successful?
So we're running the pilot program for a month. And once we collect the data, we'll know what it entails in terms of its effectiveness, how much it will cost, the manpower to see whether it's feasible to extend to the rest of the state.
All right, thank you, Katie. Oh, thank you. Dr. Alexander-Scott, you talked about how important it is to vaccinate all kids who are eligible. We're going to see the 5+ group eligible very soon, it sounds like. There are a lot of parents, though, who are still not vaccinating, even the 12 to 18 population. What would you want them to know?
Vaccination works. It's really the clearest, surest way to ensure really that your children are able to stay in school and minimize disruption from all of the benefits we know that exist with our quality education system. And it's a protective measure not only for your children 12 and older and soon to be 5 and older, but also for the loved ones around. You know, we have seniors who may be more vulnerable even as they are fully vaccinated, or other individuals who are immunocompromised. It just makes it better for us as a state, as a society, as a community. The more protected we are via vaccination, the better off we are going into the future.
What are you hearing in terms of parents who are hesitant, either through RIDO's information or anecdotally out in the community? What is behind that, as far as you know?
The concerns can vary, and it's important for all of us to be able to speak to them. All of you really are ambassadors, and being able to listen, hear what the concerns are, and respond with your own personal stories of what has worked, and just the understanding that we as a community and as a society are in a much better place the more individuals that we have vaccinated.
All right, we'll go next over here. Michael?
we've had a protocol, and I think the doctor will probably want to answer this one. We've had a protocol where students who were close contacts who were not vaccinated, which obviously is anybody younger than 12, were required to quarantine for some period, and the idea behind test to stay is to try to ameliorate some of the consequences of that. But what has been the incidence of actual infection among all those students who are quarantined? Because you quarantine them, you test them. I assume we've measured that. So I think it's probably quite low, but how many students have been quarantined, how many have been tested in quarantine, and how many were actually testing positive?
I can get back to you with specifics on that data, but it allows me to reiterate the balance that we are discussing here. Quarantining is a proven tool to disrupt transmission of an extremely contagious virus. The balance with that is particularly in our school settings, we want to take an approach that allows for minimizing transmission, but do it in a way that supports children in being able to continue to get all the benefits of in-person education. And that's why we've taken the approach of implementing and assessing through this pilot any measure we can that minimizes the disruption. And so the K through 12 close contact exemption approach is one of them. That's been in place for some time, but we need to have the proper information in order to activate it. Where was your child sitting? Were they wearing a mask? How much distance was there? Are they vaccinated? Having some of those basic mitigation steps that we've talked about for months allows children to qualify for exemption from quarantining. That's already a ready-made program. What we're talking about here today is adding to that, learning more through the test to stay. But we want to assure all families and parents that right now, working with your school community, making sure that we have that information allows your children to be exempt from being quarantined as long as they qualify with wearing a mask or some of the elements of that program that are already in place.
Well, assuming then that vaccination will, for children under 12, exempt them from quarantine requirements similarly to children 12 and older, do you have a concern that the test to stay program would amount to sort of being seen as an alternative to vaccination, and that it might work to discourage vaccination? In other words, parents may reason, well, I don't need to vaccinate my child because if there's a close contact, the child is can go through the test to stay program and be exempt from quarantine.
Vaccination works best regardless, whether a part of the test to stay or whether a part of the close contact exemption program. Any parent that wants to choose an alternative would need to know that all alternatives are suboptimal to just getting vaccinated and ensuring that your children are protected.
All right, we have time for two more. Alex and Elaine. Yeah, I think this will be for Dr. Alexander-Scott. So in this morning's subcommittee meeting, you talked about how the key milestones ahead for this next rollout of 5 to 11. It's looking like November 4th could be the soonest that could happen for kids. Parents of kids in this age group are dying to know what day they can go. Do you think that they could reasonably plan for a November 4th start date for that first dose?
I would say we're definitely focused on November, and we shared the number of vaccines that will arrive. There'll be 27,000 with the first shipment. We've oftentimes had certain dates from our federal partners, and you give a grace period or so of a week or two as it takes for them to implement distribution nationwide. So by mid-November would be a reliable time frame for parents. And starting now in working with your children to be ready to know that this valuable tool will be available to them. They serve as great ambassadors, is a great way to be ready from a parent standpoint.
And apologies if it's been mentioned before, how many 5 to 11-year-olds are in Rhode Island. So you say you have 27,000 doses, then how many kids does that equate to that could get a dose?
We have calculated about 80,000. So we anticipate that with the subsequent doses arriving, we'll have enough to meet the need.
This is a different dose, right, and a different needle, so that's what you need to get shipped from the federal government.
Correct.
Last question over to Wayne.
This is a question for you, Governor McKee. On Friday, what will happen to employees of Slater Hospital and the Veterans Home who remain unvaccinated?
Yeah, so we're going to continue to follow the rules that the Department of Health has put in place, and we're expecting to get as many in compliance as possible of the workers, and we'll work on other plans to activate strategies, including the National Guard if necessary.
Will employees be terminated?
No, I think the provisions are that there's a procedure that's going to follow a course before that would happen.